Good morning, Team Redstone. It's Colonel Smith and Colonel Meador once again. We're joined today by Sergeant Major Jimenez for our weekly town hall. We have had an opportunity to collect some of your questions, and we've got a few prepared answers. What I'm going to do this morning, though, is based on Fox Army Health Center's town hall yesterday. They generated quite a few questions. And so today, Colonel Meador is going to take the lead and answer some of the questions that came up after that town hall, and then we'll get back to, we'll get over to Garrison Sergeant Major and myself, and we'll talk to you a little bit about some of the things you may see around the installation. Colonel Meador.
Hey, thank you.
Yep.
Redstone team, family, and friends, thank you again for joining us today. As always, it's a pleasure to address you and provide information that's helpful to you during these times. I'd like to start off today by issuing everyone out there a thank you. So far in the state, Madison County is doing an incredibly great job. Off of the Alabama Department of Public Health's website, their surveillance website, and based on today's number, Madison County is 6th in the state. 2 weeks ago, Colonel Smith and I sat here addressing you where Madison County was number 2 in the state. Our numbers today, as I just said, have us at 6th, which is great because we are in a statistical manner leveling off and decreasing in some rates. So great job with the social distancing, observing Governor Ivey's stay-at-home order. It is having a very positive effect. So thank you to everybody out there for those continued efforts. It is working. A lot of great information to put out to you today on behalf of my staff and all the operations we're doing over at Fox Army Health Center to support you. Yesterday on our website, on our redstone.amed.army.mil website and our Facebook site, we posted a color-coded document which goes into the services we're offering today, and in some cases what's closed, and in some areas where we have limited services. We're in hopes that this will be helpful to you, where we've had a number of questions about what we're still doing or not, and we feel that this color-coded key will kind of help alleviate some of that confusion, whatever that may be. Please let us know if this document or this form is not helpful to you, or if there's still some clarification you might require. We're happy to come online, respond to you. I put this out yesterday during our town hall. Feel free to contact our PAO adjutant, which is Miss Cynthia O'Connor, or drop a question right on Facebook as you've been doing, or via our .mil website. Again, goes into a detail about all of our services. And with that, a quick add-in about our hours again. On some aspects of our website, our normal operating hours are still posted. So if you'll allow me to clarify some of that a little bit. During these current times, now that I screen not only every individual coming into the facility, every patient, we also continue to screen our staff members. That's required us to adjust our business hours a little bit. Normal business hours, again, during times outside of COVID, it was 7:30. Business hours today for us have us beginning at 8 a.m. And I make that point to you because we've had some questions to you about what time we're actually starting, when we're opening, when does the screening line open. Business hours for us are 8 a.m. I screen the staff in beginning at 7 a.m., allow for them some time to get into the facility and to get set up for both our screening operations for individuals and our drive-through pharmacy. So that takes a little bit of time for us to do that. So appreciate your acknowledgement and patience with us to get that set up. Some of you have asked, well, what time can I arrive? I want to get there to be first in line. I don't want to tell you what time you can't show up. You're more than welcome to come as early as you would like. I just want to make sure everyone knows that our opening time is 8 a.m. and we go through 3 p.m. Again, hours during this COVID time of a new normal are 8 a.m. to 3 p.m. And with that, another question about going back to our services, again, with respect to our key that you'll now find on our website, we have a lot of things we're still doing. White card renewal, you don't need an appointment for that. Ask that you come on in. Of course, you'll screen through our screening process and come in. That area is located right next to our lab department, which is also a service that remains very well open. And again, please visit our website, ask for your feedback on that, and what other bits of information you think we can provide you that would be helpful to you. We've had a lot of questions about masks. and what we can provide, or if we can provide, and or the requirement coming into Fox. A lot of good points about that I'd like to pass to all of you. As you know, we are following, as well as the Garrison, CDC guidelines and recommendations with respect to masks. For Fox Army Health Center, we ask that you come to the facility masked. That could be either your own cloth mask that you've made at home, or if you've been able to purchase the surgical mask or any mask barrier that you put over your facial area. We ask that you please just come to the facility masked. And I make that point especially for those of you who are coming in for an appointment or for one of the services that we're still offering there at the facility. Now, the question has been, will we provide masks? And let me go down that road very quickly with you. We prefer not to. If you present yourself to our screening tent to come in for an appointment and you are ill and not masked, we will put a mask on you. Again, we would ask that you please come to the facility masked because our resources are limited. I'm trying to maintain as many masks on hand for my staff as possible because we are looking at the long term on ensuring that my staff members have the resources they need. So again, I would ask that you come to Fox. If you're coming inside the facility, please have a mask. Any version works. Now, along with that, had a great question here recently about handling and care and maintenance of a mask. If you've made your home version a cloth mask, the washing of that is normal. You might prefer to hand wash them. Again, you're looking to maintain that mask for as long as possible. You have to be careful. Do look at the type of elastic you may have used, or if you have the regular drawstrings that you've used to make your mask. Wash them as you would any other linen, towel, or sheet. The thing you want to make sure you probably switch out, I would recommend, depending on how often you're wearing it, you might want to switch it out 2 or 3 times a week or weekly. Again, it all depends on how often you're wearing your mask, is the barrier that some of you have elected to put in your mask. There are a lot of online ideas and recommendations for what to use inside that barrier. You've heard everything from a coffee filter to a paper towel, anything to put on the inside lining of that mask. That's what you need to be cognizant about switching out fairly regularly. Again, that all depends on how often or how much you're wearing that mask. But that, apart from the cloth part itself, wash regularly, as you would any other linen, said a few seconds ago. If you have the surgical masks, the ones you've been able to procure elsewhere, the manufacturer is pretty clear about how often you're supposed to replace the mask or throw it away. Do follow those directions and guidelines. At Fox Army Health Center, we've been going on some manufacturer recommendations and also Army and MedCom guidelines about how to extend the life of some of those masks because those resources are finite and we're trying to keep as many on hand as possible. So again, a lot of great questions on masks. If that didn't answer any of them, please throw some out there. Happy to come back at you to talk about masks. A little bit about our pharmacy operations. We continue to refine our process. You all have had a lot of great suggestions and feedback. You noticed from the beginning when we started our drive-through pharmacy, we employed the Chick-fil-A method, and we continue to do that today. Would ask on your behalf or for all of you and the safety of others, if you would watch your speed. Do ask you take knowledge of when you enter the Fox driveway area. Watch your speed. We've had a couple of bumps and dings between vehicles. Nothing that harmed anybody or car for that matter, but just some gentle bumps here and there. But maintain your speed. The other reason I bring that up is depending on the volume, I place staff members in varying places depending on how backed up we are. So sometimes if you come up to Fox fairly often, you may have remembered where a staff member was positioned. Well, that may be different. So I ask for you to be very aware once you enter the facility on where my staff members are placed, because they're going to be in the road as they hail you or bring you on to ask you what you're here for so they know how best to direct and guide you. So again, please be cognizant of your speed as you come in there and watch out for my staff members. They do have vests on. So again, I appreciate you thinking about them as you come in there. Another plug-in for your pickups for refills. I've come on a couple of times and mentioned about our storage capacity, which is limited. You all have adapted quite well to this procedure we now have in place, and I so appreciate you and accommodating this new method. We just ask that as you call in your refills or you drop off a new prescription and elect to come back, that you do come back and pick up the refills. Again, our storage space is very limited, and it fills up quite quickly. So appreciate you coming back to get your refill. Another aspect about the drive-through, there's been just a slight confusion about where and how to enter the facility for the drive-through. To make the drive-through effort as seamless as possible, we've adjusted how you enter and exit Fox, where originally or usually I have two main entrances exits. We've adjusted that now, so we have one entrance and one exit. And probably the easiest way to think about this, depending on how you are approaching Fox Army Health Center, is the entrance you want is the one that's closest to the golf course. And it's the one closest to Gate 9 or Rideout Road. That is the only entrance currently to Fox. And we do that intentionally so we can keep just one loop, one-way traffic through the facility. And also the reason I have individuals positioned out there to help guide and direct you there too. So I also make that point because some of you have come into the exit and are attempting to turn around on Goss Road. Just be cognizant of that. There is a lot of traffic over there, so please be careful. If you happen to try and turn into the wrong entrance exit, just be cognizant of the traffic coming and going on that road. Again, appreciate your patience there and accommodating this loop around Fox. Screening, we continue to screen. As I've mentioned before, as you initially come into Fox for an appointment, or maybe you want to renew a white card for you or family, and screening does take just a couple extra minutes on your part as you come in there. As I've stated before, we're going to ask you a few questions. We are going to take your temperature there. And no matter what, you'll still receive the service that you came there to obtain if for whatever reason you screen positive. Meaning that you have how you answered the questions or what came across on the thermometer that we need to kind of pull you to a different area. Again, we're still going to get you the service that you've come to Fox to receive, but just want to ask that you continue to build in a couple of extra minutes before coming over to Fox, because we'll need to screen you in. And we envision the screening process is going to remain on for some time. Another aspect about inclement weather and drive-through pharmacy, we will continue to make daily decisions about executing the drive-through pharmacy predicated on weather. As I stated before, I have a number of staff members who are outside, and if I have lightning, thunder, if the rain is just torrential, I am going to pull my staff members inside and close the operation. Rarely will we close it for the entire day. So far, we've only done it once where it's been closed the entire day. That will be the exception. Mostly what's happened for 2 or 3 times is we've been shut down for just part of the day. And that means just keeping up to date with our website, both our Facebook site, just search for us, Fox Army Health Center, or the redstone.amed.army.mil. We have the COVID tab there, which gives you our up-to-date on our pharmacy operation, on whether or not we're open, when we anticipate opening, or maybe how long we're going to be closed. And again, it's the exception where the drive-thru will be closed the entire day. But so far, I'm happy to report that the process is working quite well. Testing, I'll talk to you a little bit about testing for a process that continues to work very well. We do have a testing capability resource here locally in Huntsville. As mentioned previously in some town halls prior to this one, we at Fox Army Health Center elect or determine who needs to be tested. We do that either by way of screening, by way of an exposure in some cases with some of the commands here on the Arsenal. And we have reached out to individuals. What I would convey to you is that we at Fox reach out to you and ask you, or we determine you need to be tested and figure out a time for you to come in and see us that we may conduct that on you. We do not have a drive-through testing, said differently. We don't have a testing at will because, again, our resources for testing do remain, or we're trying to conserve those resources as they are limited. So appreciate your thoughts there. Now, if you feel that you have had a positive exposure, that's something that you can certainly bring online. That's something we also find out when we're screening you at the tent, and we talk to you about that and make some determinations after which on testing or not. So again, appreciate your questions about testing. That remains the status today. We don't anticipate that changing anytime soon. As a good metric, our testing is down, which means that based on either exposure or travel or spread, our behaviors are working, and the testing is down. We are seeing a very dramatic decrease in testing, so that's a good news story for everyone out there. But again, given your concerns, please come online with us, and we're happy to address them given your situation or scenario. Again, we've moved around a lot within Fox as well as out. Appreciate your patience with us as we continue to refine our process. And as I'm moving through a number of questions had here with you, I will come online and tell you I've had a number of questions about the long term about Fox. About 3 months ago, Colonel Smith and myself, addressed the community about the potential limitations or reductions of Fox Army Health Center. And we've had a great question from the community about what's the update on that. As I understand everything about congressional decisions and Department of Defense movements on any right sizing or downsizing of military treatment facilities, all those decisions are on hold until further notice. And beyond that, I don't have any new information on Fox other than all of our military treatment facilities are in high utilization currently as far as treating, battling COVID-19, and we will continue to do that for you. And with that, I welcome some additional questions, but in the interim, I'll pass it back to my colleague here. Sir.
All right. Hey, thanks for being here again today. And much like Colonel Meador said, it is working. The number of cases out within our community where all of us live has certainly not grown in the numbers that initially were expected, and I owe that to all of you and what you have been doing. Good personal hygiene. If you're sick, stay at home, and practicing good social distancing, and stay at home. Follow the governor's orders, and when you have to move out to come to work as a mission essential person, or when you need to move out to execute essential trips to the grocery store or other, go to those locations and come right back. What all of us can do is to ensure we limit the number of potential people we impact or we come in contact with. And you guys are doing great. Something that is not talked about largely is the recovery rate. And I will tell you that based on Redstone Arsenal and the number of COVID-19 cases that were initially reported, more than half of our COVID-19 cases here that we are tracking have already recovered. That doesn't mean that this isn't serious, but it does mean that the majority of the folks that have come in contact with COVID-19 here at Redstone Arsenal have already begun their recovery. A couple things since we talked last that you are seeing here at Redstone Arsenal. You'll notice that you've got some green suit soldiers out at the gate, and I'll leave Sergeant Major to talk about that here in a few minutes, but I'll advise you that what we're doing is training soldiers to be sure that if we had a mass quarantine of individuals, we would be able to continue to provide essential services to you. Masks and face coverings. Now, the DoD guidance is very clear. It says anywhere or anytime you enter a DoD installation, you should have in your possession a cloth face covering or a mask. And that is a personally procured cloth face covering or mask. And when you enter a DoD facility or you come within 6 feet of another individual, if you can't maintain a 6-foot social distance, then you're expected to put on your mask. But that is a personal responsibility, and it is your personal estimation of 6 feet. I assure you that if two of you are walking towards one another and you get within 6 feet of one another, both of you ought to be donning a mask. But it is a personal responsibility. Now, that being said, is at our commissary and our AAFES facilities. We find it somewhat difficult to ensure that you are maintaining a 6-foot social distance separation. And so as of last Friday, entry into the commissary or the PX or any of the AAFES facilities like the Express or the Class 6 require you to don your personally procured face covering, whether that be a mask or a cloth mask made from home. That is your ticket to get into that facility. And I appreciate your assistance. I appreciate you having your mask in hand and putting it on before you go in there so that we don't have to expend additional manpower to provide courtesy patrol or other to enforce that. The other one you'll see is we've adjusted retiree hours at the commissary specifically. The commissary operates a retiree hour Tuesday through Thursday from 08 until 11. That is to ensure that those beneficiaries who have already served their 20 or 30-year term and are still receiving benefits from us have an opportunity to go into the commissary without the potential of having a younger crowd in there who might cause them to protract this virus. Once again, our retiree hours are Tuesday through Thursday from 8 to 11. And after that, it is open to the active duty service members and those service members or those beneficiaries who are not deemed as retirees. That leaves Friday through Sunday or any afternoon for all of the rest of us. I'll assure you that Mr. Somerville and Ms. Palu are stocking those shelves at differing hours. I know for a fact that they are enforcing limits on the number of personnel, on the number of meat items, the number of paper products, the number of flour, cornmeal, and so forth. Those items that everybody wants to get, there is a limit. And I certainly ask you to only buy what you need so that we can ensure that we rebuild our stocks. The other topic, we did have I've got a series of questions, but I will take this as we did receive quite a few questions that I'm going to classify as tenant organizational questions. Questions like, will face masks and gloves be provided for those mission essential personnel? Or how will we enforce social distancing in the different buildings? Why, or am I on telework, or when will I go on telework? Ladies and gentlemen, those are questions that only your tenant leadership can answer. As the Garrison, our job is to provide a safe and secure environment. Our job is to assess the environment and the virus as it exists within the community and recommend those precautions that all of us should be taking. And in the case where a precaution is necessary for the good of the whole community, such as wearing cloth face masks, such as guards not receiving your card anymore and only doing a visual inspection, such as going to appointment only at the CAC and ID card center, or closing down or changing the dining facilities to take out only. Those are installation-wide decisions that both Colonel Meador and I talk about profusely, and then we make recommendations to the senior leadership to impose those across the installation. And what you've seen is that those precautions are very much in line with the state's stay-at-home order and the state's designation of what essential services are. And our job is to match those and hope to fortify what your community is already doing to help protect you. But when it comes to how your specific organization is continuing to execute business, who is on telework and who is mission essential, that is your tenant command's decision to make. I absolutely encourage you to please engage with your supervisor and your leadership should you have questions on how your organization is going to continue to operate. There is one question that was somewhat related, and it poses to: is there an alternate, a tentative date that we should expect to all come back to work, or will the workforce be phased in gradually? And if so, are those persons that are identified as emergency and mission essentials, how will managers check? So I can tell you that today we do not have a date for when we expect to return to normal operations on Redstone. What we do have are a series of triggers that are related to the spread of COVID-19 that would either cause us to come up with additional precautions that we would seek to put in place to help protect you, or a relaxation of some of those precautions. And as we get better information on the continuing spread of the virus due to all of the social distancing precautions we've already put in place, we will be able to make recommendations that either become more stringent or less. Yes, I fully expect that at the point in time where the virus infection rate has slowed, and where we believe that there is a lower risk of this infection starting back up, more virulent or spiking yet again, that we will recommend that we begin to relax some of the precautions. And when we do so, I expect your tenant organizations to look at their mission essential tasks and begin to increase the number of personnel they bring back onto the installation in a phased manner to perform that task. And after a period of time, and we continue to watch the virus become less virulent, I would expect that mission support personnel would then be asked to come back in. And eventually administrative support and non-essential persons or non-essential tasks to your specific day-to-day tasks. But I think that's a longer process. And I think that is certainly predicated on how the virus acts and the level of danger or the level of risk that we believe we would be placing the workforce at. That's to come. For the next couple of weeks, I expect that we will continue to ask you to adhere to the governor's stay-at-home order, to continue to maintain contact with your chain of command, and to continue to provide support to our missions in the manner that your tenant command has already designated. We're doing a great job, and our mission goes on. We're doing well, and we're doing that because of you. While I get ready for a couple other questions, I'm going to pass this off to Sergeant Major for a couple announcements from him and answers for his questions.
Thank you, sir. Good morning, Team Redstone, families, friends, and our community, Redstone 7 here. Before I get started on some of the questions that came in, I just want to remind everybody and our team out there that our number one priority is readiness, and we continue to support the warfighter and our mission in safeguarding the installation and continuing our operations here safely. One of the questions that came in was about barbershop hours and operations. I just kind of want to remind everybody about barbershop hours. It still is open. Again, we ask you if you're coming in to utilize it that you have a mask or a cloth. But Monday through Friday, 8 to 6 in the afternoon or 1800, it is open. Saturdays, 8 to 1700, 5 o'clock, and Sundays, 10 to 1700, 5 o'clock. And active duty in uniform will receive priority between the hours of 11 and 1300 or 1 o'clock each day. Another question that came in was, has Redstone MWR halted requirements for RV to move periodically during the COVID-19 pandemic. The RV park is not currently accepting any new reservations, and we are still having those tenants that are staying out there adhere to the 60-day rotation, and that is just to continue to prevent any homesteading. Like the Colonel talked about, we have been doing some training with our BMM, which is our borrowed military manpower. So if you mission essential personnel or some of you have come in through the gates, you have seen some soldiers in uniform out there working on the gates and getting trained and working hand in hand with our civilian counterpart guards. Like the Colonel talked about, if we should have to activate them this week and into next week, they will be training and you will see them out there on the guard. I was out there this morning on gate 9, and we want to thank you for everything you're doing to continue to do our part and your part to stay safe out there. I just want to personally thank the first responders, all our medical personnel, our police officers out there, our custodial workers, PX and commissary workers for all the hard work that they're doing out there, working day in and day out and keeping us safe and keeping our operations going for the civilian workforce, for the soldiers out there, and for the whole team and community of Redstone. With that being said, I'll pass it back over to you, sir. Thank you.
All right. Okay, so I have a couple questions I'm going to field, and then I'm going to pass it back over to Colonel Meador. So first question, I visited Fort Rucker, Alabama yesterday, and they had medical personnel stationed at the entrance of the PX taking people's temperatures prior to them entering the complex. Why aren't we doing something similar at Redstone Arsenal? Ladies and gentlemen, the reason we're not doing that is because there is a body of evidence out there today that suggests that unless those screenings are done in a controlled environment and done in a manner that allows us to be very specific, we are unlikely to capture persons who are asymptomatic regardless, and because those temperature readings are not the entire indicator. It requires us to do a much further screening. What we are counting on is each and every one of you to do your part. If you are sick, please stay at home. And when you cannot maintain a social distance, we ask that you have your mask on, and we ask that you are only using those facilities for essential purposes. We believe that those precautions, in addition to good personal hygiene, will help protect each and every one of us, almost as a herd mentality. As each one of us takes care of ourselves and limits where we go, we can help protect those around us. The Fox already is performing quite a few missions and is doing everything they can to keep our workforce healthy. And I would hate to, as well as Colonel Meador, would hate to dilute the quality of care that we provide for you elsewhere in order to screen people at every building that they go into. That is unfortunately, one, not effective, or we're finding it to be less effective in the places that we impose it. And it increases the manpower, the number of people that we would have to actually bring in and potentially expose. So we ask you to do your part. When will the tax center open up for retirees? So ladies and gentlemen, our number one, the most vulnerable population for us is clearly spelled out in the CDC guidelines, and it does include age, and it does include pre-existing conditions. And we find that though our volunteers at the tax center, they are very experienced personnel, but they've got that experience over a large number of years serving all of us. So we have asked our volunteers not to come in so that we don't put them in a potential environment where they could be infected, and so that we don't draw in those retirees into another position where they could be infected. So until we see the virus continue to diminish to levels where we believe that the risk is low, we will continue to suspend the volunteer tax center. When we're able to bring the volunteers back onto the installation, then we will open the tax center for retirees. There's a series of questions here about Sparkman Center being fogged. I will tell you from the Garrison's perspective, it is our intent to ensure that every building that our workforce returns to has been disinfected. So currently, those buildings that are not occupied are being visited by a special team who goes in and disinfects all of the unoccupied buildings. Our intent is that when you come to work, you should see a sign on the door that says that this room or this building was last disinfected on this date. That, I think, is what you're calling fogging. So today, Redstone Arsenal is working its way through the 16 million square feet of office space to sterilize or disinfect those buildings so that when you do return to work, you return to work in a cleaner environment than you left. The solution we are using is CDC approved. The methods we are using are CDC approved. And we have two very specially trained teams that go around to all of those buildings to do that. Unfortunately, yes, it probably does leave a little bit of a residue depending on what you left on your desk. We'll do our best to wipe off that residue from all the exposed surfaces, your keyboards, your monitors, your desktop, etc. But you may find some residue. We ask that each of you engage in some personal cleaning upon your return, knowing that your cubicle or your office area has been reached by our custodial services. The other question, there are a lot of asymptomatic people. What preventions are we taking at Redstone? And are we testing every employee who works on RSA? And I will tell you that, one, I'm going to defer this back over to Colonel Meador to talk about asymptomatic personnel and testing on Redstone. And I'm just going to go back to the simple precautions that we've asked you to take. We've asked you to demonstrate good personal hygiene, to wash your hands for at least 20 seconds, sing the birthday song, the shark song, or others, to make sure that you keep yourself clean. And if you're sick, stay at home. Asymptomatic people obviously are not going to know they're sick, but at the same time, they wouldn't know to be tested. And then likewise, social distancing takes into account those asymptomatic personnel. The wearing of cloth face coverings takes into account those asymptomatic personnel. We're asking everyone, because we realize there are asymptomatic individuals, we're asking everyone to help us in these precautions. And then, of course, when you stay at home as an asymptomatic individual, you are reducing the pool of people that you could come in contact with. We do not have enough test sets to test everyone, and frankly speaking, we would probably have to test everyone every day. And that would lead to an inability for us to get timely tests back, and we would overburden the medical system, and that is exactly what we're trying to avoid. So before I pass it over to Colonel Meador once again, the last question I had is, can someone answer how VA beneficiaries can receive their privileges at the commissary? And can I bring my dependent who does not have an ID to shop with me? Well, of course. As a VA beneficiary, if you are authorized commissary privileges and you have an ID card that allows you access to the commissary, you, as usual, can sponsor an individual to come onto the installation with you and enter the commissary. Of course, we're going to ask for them to have their cloth face covering and mask, but that individual is welcome to enter the commissary with you and assist you to get items off the top shelf or off the bottom shelf and help you conduct your shopping. VA beneficiaries have now been extended out to disabled veterans, and so long as a disabled veteran has their disabled veteran ID card, they can still go to the VCC or the Visitors Control Center at Gate 9, and they can still receive access to Redstone Arsenal via a sponsored Redstone Arsenal badge, and we're still doing that today. to ensure that we continue to deliver benefits to our retirees, our disabled vets, and our active service personnel and their dependents. But commissary privileges are no different today than they were before. And I ask you to just please observe the rules and be cognizant of the others around you. And of course, at the commissary, buy only what you need so we can continue to build our inventory and provide you those valued products. Now I'm going to turn it over to Colonel Meador again. He's got a couple questions for the medical side.
All right, thank you. Had a lot of couple of good questions come online here as we've gone through our town hall with you today, and I'll address a couple of them right here. Again, thank you for bringing these questions to us. First question is, I'm active and retiring soon, and I need a copy of my medical records. When is the record section going to reopen? I will tell you that we are open now, and would ask that you, for an appointment or a service that is important, such as you getting ready to retire, come on in to our medical records section, where they can give you advice and talk to you about timelines depending on when you're going to retire and how to obtain your records for your processing as you need them. Again, that's something we have to build a little bit of time in there so we can screen you through and come on in. Along the lines about medical records, had a question here about, are you really concerned about our white card expiring, and do we really need to come in just to renew that card? I would answer that with respect to the amount of time you have, and I'll give you a scenario which I think may help answer that question. So am I concerned about it only in so much that if you come in for an appointment with either you or your dependent into any of our facilities, would ask you to build a little more time in before your appointment to just swing through medical records and get your card updated. We have on occasion updated those cards within any of our red, white, and blue teams with our MSAs, but am I concerned only in so much that you can get your appointment in a timely fashion when you arrive at Fox, because it may delay you in some way, shape, or form. So if you have a little bit of more time, come on in a little bit early before your appointment, and we'll get your card updated, renewed, and we can knock out two birds with one stone. So again, it's about how much time you have for you and to accommodate you in your appointment. I had another great question here about, are we going to start antibody testing? Currently, no. And I don't anticipate this capability will come to a military treatment facility anytime soon. We've had a rapid fielding initiative take place for our in-house lab testing. We anticipate our equipment to arrive any day now to be able to do our testing in-house. But for antibody testing, I think we're a little ways out from that. I know there's some commercial aspects and venues that are taking this on currently. I do not have an idea of when that will come into the department, that we may take advantage of that for all of our beneficiaries. Along with testing, I had a question about turnaround time, and I will tell you that initially when we started our testing and with our initial contract through lab testing, the wait time started growing exponentially as all of the other medical facilities in the state were now inundating this one facility. We moved to another contractor, and now I can tell you our returns are coming in within 24 hours. So the resources to test it's finite. And that's sort of the situation we find ourselves in, where what we can test and who we should test is something we scrutinize a bit. The turnaround time is good. It has improved exponentially. Again, 24 hours at most, 48 for tests that we do today. And I've had a lot of good results from this organization we're now aligned with here locally. Initially, our tests were going to Birmingham and some places elsewhere outside the state. But again, we've had great success with this current company. And again, look forward to your continued great questions coming through. Another question about how are we as far as testing compared to other places? Well, really good, actually. Again, this local contractor has aided us incredibly well as compared to some of our other military troop facilities that still have a little bit of a longer wait time, given where they're located and the number of tests that they're going through to push out to the local or grand or national labs as they exist out there. So again, great questions on testing. We'll continue to look at that. And as we see different aspects about how testing needs to be expanded, and as resources become available, we can look at that then. But Colonel Smith had some great points to you on testing and how we're looking at that today. I want to dovetail on something that Colonel Smith did bring up to you that we've had questions about. And the question is, when can I see my doctor for a regular appointment? This is an awesome question. And we continue to dig into the timelines about these types of normal services each day. And as he mentioned, Colonel Smith mentioned about triggers. He was absolutely correct. Based on certain triggers that happen here in the near future, we make recommendations to our leadership here on the installation, General Perna and General Daly, about how we, Fox and the Garrison, as we are very well nested, on how we should look to reopen some of those services to you. I am tracking that a lot of you are looking for those services to return to normal, as are we. And however, as we are having great success right now, that's what we don't want to do is stifle that, or for whatever reason, produce a situation where we have a resurgence in our numbers. So we were looking at that daily and very carefully. We owe you, I owe you some thoughts from Fox on what those timelines look like, but they are very deliberate, and they'll be predicated on good data about the numbers and how we see a little bit of time here in the future where we can ensure that for what services we do open up, and when we open it up, that again, we don't indirectly put a spike in the numbers for infection rates here in the area. So I assure you that is something we are looking at daily, and I look forward to coming back to you with Colonel Smith on what those timelines look like and those phases. So again, keep the questions coming. For whatever reason, if we run out of time today, myself and Miss O'Connor will get back to you out on Facebook or email back to you. But again, I've appreciated your questions today. Thank you.
Hey, thank you. All right, so I did notice some discussion on the email or on the messaging board thread there regarding VA beneficiaries and whether their kids or dependents can come in and shop with them. And without knowing the situation specifically, I would surmise that potentially you were attempting to use the commissary during the retiree hours, and you were bringing an underage individual with you. During those retiree hours, we are attempting to protect the more vulnerable population. And so during that time frame, you've got to be over the age of 18 or be packing a retiree card in order to get into the commissary. Unfortunately, that's one of the precautions that we've put in place to protect that vulnerable population. And I ask that you continue to observe it. And I'm sorry if that puts you at a disadvantage, but you would be able to use the hours after retiree hours for those underage individuals. Sandra, I saw your note there, and yes, the trails and the roadways are open if you wish to come out and bike and run. Of course, we have suspended the recreational access badge and our visitors badging. If you don't already have a sponsored Redstone Arsenal badge, we won't be able to give you one of those. But if you do have access to the installation, we encourage you to get out here and use our trails, use our roads to get that socially distanced physical activity in. In fact, I'll tell you, look for a post from Sergeant Major and myself coming up here in the near future relating to that topic. I did have a question. Is the One Stop still open for walk-ins? Unfortunately, the One Stop is not open for walk-ins. You may call to the One Stop, and Miss Frederick, our PAO, has that number. It's posted to our Redstone Arsenal website as well as to Facebook. But you can give them a call, and if your CAC is expiring within 30 to 60 days, we'd gladly make an appointment for you. I did notice that someone said they needed to get their PIN reset. I'll tell you that there's a body of information on our website that shows you how to go to the DoD ID card or US ID card website and update your PIN numbers and get that updated. If you can do that internally, that would certainly reduce the number of personnel or the number of appointments that we need to try and see each and every week. expiring CAC and ID cards, DOD is working a policy today that allows your CAC and ID cards to be extended out until August of 2020. And that ensures that your benefits will continue to be provided regardless of whether or not your ID card is expired. And here on Redstone Arsenal, today we are allowing up to 60-day expired cards to enter the installation in order to be able to come to the commissary or the PX or to come to the one-stop so that we can get you updated, given that you have an appointment. Please check our website for those numbers, and we will be happy. We'll be happy to take care of you. I will tell you that if you're looking to get your certificates updated, please give us a call, or please go to the website and we can help you with that. And additionally, some of your organizations have the ability to reset your certificates internally. Please check with your organization to see if they can assist you to do that, because I know a lot of you that are teleworking need those certificates. The last question that I have, and I haven't seen any new ones come up. Let me check real quick, put on my old man glasses. The last question I have is specifically the golf course, and the individual is interested in when we'll open our golf course. A lot of the local community golf courses are open, and I recognize that social distancing can be experienced on the golf course. However, in order for 2 people or 4 people to come out and golf, we have to bring a significant workforce together each and every day to maintain those grounds, as well as to provide the services in the pro shop, the grill, and get you out onto the course. And considering that, we're not really willing today to bring all of those individuals in order to support the few rounds of golf. We will bring it back as soon as this virus deteriorates further. And I assure you that each and every day our golf pro and golf manager are monitoring that and are asking us when we can bring them back. The last question, I will make this the last one, and then we'll go through a couple closers from each of us. Are all facilities and buildings on RSA going to be decontaminated and prepped for whenever the determination is made for employees to return to work? I will tell you that it is our aspiration at the Garrison to get to each and every workspace and to disinfect each workspace as we bring you back to work. Today, we have already worked through about 4 million square feet, and we will continue to work through that between now and your return to work. Our goal is to balance with your tenant commands, your return to work, with our ability to complete your building. That's our aspiration, that's our intent. Our workforce, our custodial workforce, and the DPW crew are working at that each and every day. And that is what we wish to have done. But it all depends on how quickly each and every one of us comes back to work and how much square footage we can get through. With that said, I'm going to pass it off to Sergeant Major.
Okay, sir. One of the questions that came in, team, was the beauty shop and nail salon. Unfortunately, that shop is closed right now, and the barber shop, the 2 barbers that are in there working at any given time are wearing a cloth or protective gear, and they've separated those 2 chairs to continue separation. They're only allowing 2 people at a time in the barber shop, and anybody that's having to wait is out in the hallway with 6 feet of distancing to keep a safe distance. Again, I want to thank you guys for doing your part and leading the way as we continue to dominate this virus. Continue to do your part, and we will continue to do ours and do our best to continue to keep our operation going and keep our community safe. Thank you.
Colonel Meador, back to you.
All right. Thank you. What I would put out just as a closure for everyone out there, while the predominance of our attention has been directed towards COVID-19, there's a lot of other colds and flus out there and ailments that bother you. And if that's the case for any one of you out there, come in and see us. We are open to see and treat you for any of those issues or concerns you have. Our radiology services are open as well. If you sprain an ankle or you have a suspected fracture, we're able to assess you, take care of you. And I do ask you to look at that. Don't hold off on a treatment scenario for whatever reason. If you think that you don't need to be in there for whatever reason, give us a call and talk to us about it, and we'll give you the best recommendation we have. But leaving today, please know we're open for business, and as you see on our website, you can see what services are limited and really by hours in most cases. But we look forward to seeing you. Thank you.
All right, folks. I will echo what Colonel Meador just said, and that is that Redstone continues to combat COVID-19. We're doing well. Likewise, Redstone Arsenal is contributing each and every day to the benefit and security of our nation. Whether we are working logistics to support the medical emergency throughout the United States, whether we are defending in space or defending from any missile threats, whether we are developing the next tool that our soldiers will have to use into the future. Redstone Arsenal's mission remains necessary, and it remains essential to our national security. And only you and your hard work at home and your social distancing and helping to protect our workforce will allow that to continue. I ask you to still continue to do your part. Maintain great personal hygiene. If you're sick, please stay at home. Please stay in contact with your supervisor so that we know you're potentially sick and we can get you the help you need when you need it. Please, whether you're on the installation or you're off, maintain that social distance and adhere to the stay-at-home orders. Many of the services that are provided here at Redstone Arsenal have been suspended because they are not consistent with the stay-at-home orders, consistent with our governors. We are doing our best to limit the number of personnel we bring onto the installation each and every day, to limit the requirement for anyone to be in close physical contact, and to enable you to be at home and to enable you to have essential services. We're doing our part. I ask that you do yours. Thank you all very much, and with your help, we will combat COVID-19 and we'll win. Thank you very much and have a great day.